Welcome, curious minds, to another deep dive. Our mission here is to take complex topics, dive headfirst into the sources you share with us, and emerge with the clearest, most impactful insights, giving you a real shortcut to being well-informed. Today, we're taking on a truly vital and often overlooked subject, the health status and access to quality healthcare for the Roma and Sinti communities across Europe. We've got a comprehensive scoping review here that really pulls back the curtain on this intricate challenge.
Yeah, what's fascinating here is that this isn't just about numbers and statistics. It's about understanding the multifaceted and, well, deeply human challenges faced by what's believed to be Europe's largest ethnic minority group.
That's exactly right. So our goal for this deep dive is to distill the key findings from this extensive review. We want to help you grasp the major health disparities, the specific issues affecting women and children, and crucially, the significant barriers to care.
And also, importantly, what concrete actions are actually being taken or what could be done, to improve the situation. We'll be drawing on research spanning from 2015 to 2023, gathered from reputable sources like PubMed, Google Scholar, and the TRIP database to give us a clear, up-to-date picture of this evolving landscape. Okay, let's really unpack this.
Great. So to begin, what does the evidence tell us about the general health status of the Roma and Sinti compared to the wider population? What's the big picture here?
Well, the studies are quite stark, really. Their health status is generally and significantly worse.
Worse how?
We're looking at a profound gap in life expectancy. Roma men live about 7.5 years less, and women 6.6 years less than the general population.
Wow.
And in some areas, this disparity can extend to as much as 15 years.
15 years, that's a staggering difference. It's not just an abstract number, is it? The review really highlights how this is a stark reality, particularly for those living in segregated suburban camps.
Precisely. And this condition, this poorer health and shorter lifespan, is prevalent across the entire population.
Yeah.
That includes women and children, which indicates deep-seated systemic issues that go way beyond just individual circumstances.
So when we break it down then, what does this actually mean when we look at specific types of health challenges these communities face?
Okay, so if we connect this to the bigger picture, many Roma and Sinti communities, especially those in segregated settlements, they face markedly higher rates of communicable diseases.
Okay, like what specifically?
We're talking about illnesses like measles, hepatitis B and E, tuberculosis, diarrheal diseases, typhoid, and scabies.
And it was striking to see how the review links this directly to lower vaccination coverage. It even points to how the COVID-19 pandemic really shone a light on this challenge, right?
Absolutely. Much like past measles outbreaks have done too. It's a critical piece of the puzzle.
So the low vaccination rates?
Yes. Combined with severe environmental factors like inadequate access to clean water, poor sanitation, and ineffective waste management. It creates an environment where these diseases can spread rapidly.
A perfect storm, almost.
You could say that.
Yeah.
And this also includes zoonoses, infections transmitted from animals because many settlements have unregistered animals living in very close proximity to people.
Okay. Shifting our focus a bit from infectious diseases, what picture emerges when we look at chronic conditions? I saw some truly concerning statistics on diabetes and heart health in the review.
Yeah, this raises an important question about how lifestyle intersects with access to care. Studies reveal a really high prevalence of metabolic diseases like diabetes.
How high are we talking?
For instance, a Finnish study found that 1 in 4 Roma men and 1 in 3 Roma women had diabetes.
1 in 3 women, that's huge.
It is. And they also show higher rates of metabolic syndrome. That's that cluster of conditions like high blood pressure, high blood sugar, excess body fat.
Right, the ones that increase risk for other major problems.
Exactly. Together, they increase your risk of heart disease, stroke, and type 2 diabetes, alongside cardiovascular disease, obesity, and hypertension in general.
And here's a point that really caught my attention, especially concerning the younger generations. The review highlights dietary habits, with Hungarian studies showing incredibly high regular consumption of sweets and soft drinks among Roma children.
Yeah, the numbers were, 60–80% consuming these things 5 times a week or more.
That much. Wow. And is that linked to genetics at all, or is it more environmental?
Well, while some research is exploring potential genetic predispositions, the evidence right now remains inconclusive for explaining the widespread prevalence.
So it's not destiny, then?
Doesn't seem like it. The overwhelming drivers appear to be socioeconomic and behavioral factors, things like poor diet, limited access to preventive care, and the environments they live in. It's really about the interplay of all these factors.
Okay. The review also gives particular attention to women and children, highlighting some particularly vulnerable areas. What are the unique health challenges they face within these communities?
This is indeed a critical area. Studies show, well, alarmingly young ages for first sexual activity and marriage.
How young?
For instance, a Bulgarian study found the average age for first sex among Roma women was 16. A Serbian study indicated almost 40% gave birth before age 18.
40% before 18.
Yes, and 10% before age 16.
Goodness.
And this often leads to severe complications, higher rates of abortion, premature births largely due to limited access to crucial prenatal care, and low contraceptive use.
And what does that mean for the health outcomes of the children themselves? How does this vulnerability sort of carry forward?
Well, their vulnerability is profound. There is a higher rate of hereditary diseases, partly due to intermarriage practices in some clans,
Okay.
and a disproportionate rate of sudden infant death syndrome, SIDs. Beyond that, basic issues like, say, getting glasses for vision correction are traditionally uncommon,
Right.
and oral hygiene is often insufficient, leading to high rates of dental caries, cavities, often because of that excessive sugary drink and sweet consumption we just talked about.
I was also really struck by the malnutrition statistics you mentioned earlier. Acute malnutrition at 4.8% versus 1% in the general population.
And stunting, where children are too short for their age, at 21.4% versus 2%.
It's a massive gap. It just screams environmental impact, doesn't it?
It undeniably highlights the severe impact of environment and poverty. However, there was a Serbian study that offered a glimmer of hope.
Oh.
It showed that children born to educated mothers and living in households with improved sanitation were actually better nourished.
So that emphasizes the powerful role of socioeconomic factors, education, basic infrastructure in improving health.
Exactly. It shows things can make a difference.
Okay. Now, the review touches on genetics, but also on cultural factors influencing health. How do these play into the overall picture of health disparities?
Right. So while some specific genetic predispositions for certain conditions, like kidney failure or thyroid cancer, have been identified in specific Roma groups,
Okay.
the overall evidence linking the widespread health disparities primarily to genetics, it remains inconclusive.
So it's not the main driver across the board.
It seems not. The review suggests that social isolation and intermarriage might contribute to the recurrence of specific genetic conditions in some subgroups, but it also notes that Roma are not, genetically isolated as a whole. There's significant gene flow from other European groups.
So it's not simply a matter of genetic destiny, like we said, but a much more complex interplay with cultural beliefs and practices, often rooted in their distinct social structure.
Exactly. And what's fascinating here is how these cultural beliefs can profoundly shape health outcomes. For example, serious illnesses like cancer can be seen as taboo.
Taboo.
Yeah, something hidden from the community, which means they're often diagnosed very late, compounded by poor access to screening in the first place.
Mm.
And discussions around death or, say, organ donation are often avoided within the community.
And I saw that the way information about health, like, say, immunizations is received, can also be very community-centric.
Yes, often through social media or word of mouth within the community itself, rather than through formal health channels.
Which raises a critical point about how health information is best disseminated, right? You need to understand those channels.
Absolutely. And additionally, the review notes a high prevalence of mental health issues. We're talking depression, stress disorders, and somatization.
That's where psychological distress shows up as physical symptoms.
Precisely. And Roma women often show a higher symptom burden. These issues are frequently underreported and inadequately addressed, which just further compounds the health disparities.
See, it all layers on top of each other.
It does. And the review points out that in some isolated groups, strong internal group laws or norms can even prevail over external social laws, profoundly influencing health behaviors.
Okay, so it sounds like there are just significant systemic and cultural hurdles at play here. What specifically limits Roma and Sinti people from accessing the healthcare they so clearly need? What are the big barriers?
Well, the most prominent finding really is a pervasive and deep-seated mistrust of healthcare systems. Yes, not just questioning the efficacy of treatments, but also mistrusting the perceived quality of care and the fundamental relationship with medical professionals.
Okay, let's unpack this. What exactly contributes to that profound mistrust? Where does it come from?
Well, there's often a strained relationship, which is frequently exacerbated by language barriers and significant cultural differences.
Leading to communication breakdowns.
Exactly.
Yeah.
And compounding this are perceptions and often realities of both direct and indirect discrimination at healthcare access points.
Hmm.
Plus, there's a persistent lack of culturally competent staff across Europe, people who understand their background and needs.
So it's not just about physically getting to a clinic, but truly feeling understood, respected, and safe once you're actually there.
Precisely. And then there are other practical barriers identified in the review. Things like mobility issues, the difficulty or just the cost of physically reaching healthcare facilities.
Transport, yeah.
The cost of medicines if they aren't free. Illiteracy challenges, the spread of misinformation within communities, and importantly, prior negative experiences with healthcare providers.
So one bad experience can put someone off for good.
It certainly can. And in some countries, compulsory health insurance or other cost-sharing mechanisms also actively discourage seeking care, especially for preventative services.
Right.
It all contributes to this powerful, damaging cycle of marginalization.
Okay. Given these complex and, frankly, deeply entrenched challenges, what interventions have proven effective? Or what's being recommended to actually improve healthcare access and outcomes for Roma and Sinti communities? Is there hope?
Yes, definitely. The review highlights several key areas for action. A crucial first step is directly addressing those communication barriers
How?
through training healthcare professionals in Roma and Sinti cultures, including giving them an understanding of gender dynamics within the communities.
So cultural competency training.
Essentially, yes. And fostering a welcoming, non-judgmental approach right at that first point of contact. This is shown to be incredibly effective, especially when facilitated by community health workers or peers from the community.
So using people from within the community helps bridge that gap.
Immensely. It really is about building bridges of understanding, not just, opening the doors to a clinic building.
Makes sense. What else?
Well, establishing mobile clinics or exclusive early access points has worked well, providing culturally sensitive counseling and really clear information.
Clear, accessible information is key.
Absolutely. And using flexible booking systems, maybe with targeted invitations and reminders, have also shown significant success in increasing engagement and follow-through.
Now, one of the most promising areas highlighted for solutions involved real community engagement. How does the review suggest leveraging that for better health outcomes?
Yes, that's where it gets truly impactful. Participatory approaches have shown immense promise.
Like what kind of approach?
Like workshops where healthcare workers and community members can engage directly, share perspectives, and build mutual understanding and trust.
Co-designing solutions, almost.
Exactly. And using those facilitators or community mediators, we mentioned people who act as a trusted point of reference for specific health needs. They help bridge those cultural and linguistic gaps while actively fostering trust.
That seems vital.
It is. And it's important to note that the EU has committed, at least on paper, to reducing health inequalities for marginalized groups like the Roma and Sinti. National guidelines are also increasingly encouraging more inclusive and empathetic healthcare delivery.
So there's policy momentum, too.
There is, yes. So it sounds like the path forward really involves a multi-pronged approach, one that deeply respects cultural nuances while simultaneously addressing fundamental health needs, all driven by a spirit of collaboration and partnership.
Wow. This deep dive really makes you appreciate the intricate layers of challenges faced by the Roma and Sinti in accessing quality healthcare. It's everything from specific disease burdens to systemic discrimination and those deeply rooted cultural factors that shape health beliefs.
Yeah, and if we connect this back to the bigger picture, the review really underscores that improving health outcomes for these communities isn't just, a humanitarian concern. It's a public health imperative for everyone.
How so?
Well, as the source highlights, widespread diseases, like the communicable ones we discussed, they simply cannot be effectively addressed across society without fully involving a minority groups and ensuring their health is protected.
Because disease doesn't respect community boundary.
Exactly. It ultimately prevents problems for the whole community, the whole society.
Right. And this raises, I think, an important question for you, our listener. Given these challenges of cultural trust and the profound importance of community-led solutions, how might addressing health disparities in marginalized groups like the Roma and Sinti actually lead to stronger, more resilient, and maybe more equitable health systems for everyone?
That's a lot to consider for sure. We certainly hope this deep dive has given you some valuable insights into this really critical issue.
Join us next time for another deep dive as we continue to cut through the noise and get to the heart of what's truly important.